Thank you so much, everybody, for joining us. I'm Lerato Aliu.
I'm Thabang Mabogoane.
And welcome back to LBS.
Love and bullshit.
Sizzle on the beat, money on the beat. Yeah.
Today we are joined by Dr. Larisse Badenhorst. As we have said, she is a sexual therapist, and her office is where we are shooting from today, and it is in Bryanston at the Center of Integrative
Management. No. Management.
Integrative Medicine. Pardon me.
Autonomy. Yeah.
Anywho, welcome, Doctor.
Thank you. Thank you.
Today we're going to talk about sex.
Oh,
When are we getting to the sex?
I'm used to it. So
we were telling the audience that there's no need for us to try and give our 2 cents, because we clearly don't know what we're talking about.
Really?
Personal experience is always good. Always
We
good.
needed a professional to come and demystify the myths.
That's perfect.
Yeah, can you tell us a little more about yourself?
So I started working at My Sexual Health 2 years ago. I was in general GP practice before, and then I had the wonderful opportunity to join My Sexual Health. We are medical doctors, we are therapists or psychologists, there are physiotherapists that are part of our team. So we are a whole holistic multidisciplinary team in essence that helps with sexual issues. Sexual issues can be anything from erectile dysfunction, low libido, premature ejaculation. We help a lot of women with contraceptives, hormones, so menopause. Us women, we always
Please don't
struggle
look
with
at me when you
hormones.
say
She's
menopause.
also looking at me when you're talking about erectile dysfunction.
We don't know. We can go into this.
Oh, okay, cool. Yeah, we can. Let's dive into that.
We have a very big community of transgender patients that we treat.
I didn't see that.
Yes, and then what else do I do? Yeah, that's about it.
You also
I
do
think
HIV.
Yes, that one I forgot. HIV, STIs.
You see, even I know how much you do. You don't know how much you do. You just keep piling on these qualifications.
So that's basically what we do. So I run the medical side of things. So I make sure that we do all the correct blood tests. We treat you from a medical perspective. And then I get the psychologist if we need a psychologist involved. There's always a psychological component to anything. And it's because our brains are our most powerful sex organs that we have. So there's always some therapy that is needed. I believe everyone should be in therapy, but that's just me. And physiotherapists, we do a lot of sexual pain. That's one thing that I forgot. So that's where our physiotherapists really come in handy. And they do a lot of pelvic physio work with our
Like
patients.
if your partner has a big penis.
No, not necessarily. So we have the unfortunate patients that have sexual pain with very well endowed partners, but it's not always the case. You can be very small or just an average bloke with an average sized penis, and she can still have pain.
And what causes that?
A lot of things. So hormones is one,
Okay.
of which the contraceptive pill is one of the big contributors. It causes local deficiency of hormones within the vaginal area, so that's why they tend to have pain. Muscles that are stiff, okay, and obviously women go through different phases in their lives. When you are pregnant, then everything is lax because the baby's supposed to be pushed out, and then you've got pelvic floor dysfunction, which then contributes to pain, skin conditions in the area, recurrent infections. So there's a long list of things that can cause it. And I mean, there are women, it's so common for women to suffer from it. And the thing is, I think because we live in a very conservative country when it comes to sex, people don't talk about it.
Your brother, that it? This boy.
Women can't approach a friend and say, geez, do you also have pain during sex? And some women think that it's normal. Yes, it is uncomfortable the first time when you have sex. Obviously, nothing has gone in there that big, so everything needs to stretch and be merry, but the pain shouldn't last. And I think that's where the misconception comes in, where a lot of women just think that this is the way it's supposed to be. And it's sad. It's sad. I mean, we've got unconsummated relationships for years where they were never able to penetrate. And we help those women. It's amazing. It's really very satisfying to help them.
So hold on, you help them eventually
Yes, to have
to receive.
successful pain-free sex. Yes.
Wow. Okay, cool. So, like, tell me this: is it? Does it have to do with some form of like relief, where the pain build up?
So
Because in my mind, I feel like I think you mentioned something about like the skin and stuff like that, how it affect all of that. I thought maybe it would be because there wasn't like an actual.
Orgasm.
There you go.
Yes, the aha moment. So the thing is, that woman will never reach the aha moment because it's too sore.
Oh, but that's within penetration. What about
Yes.
like vaginal stimulation?
A lot of the women, yes, can kind of accommodate foreplay in the area, but some women have pain right around the vaginal opening. It's not necessarily in the vagina, it's even on the outside. So they can have pain in the whole vulval area, which can actually affect foreplay as well. So a lot of those women have never reached orgasms. Their partners can hardly get close to there. And the thing is, it becomes such a, I always tell them it's never a psychological thing in the sense that it's all in your mind and you have to drink a glass of wine and get over it. There's a lot of women that go and see medical professionals that they are told, you just need to relax. But the thing is, they're so tensed up that if you get close to that area, they just kind of, they cringe. Just of the thought that something has to go close to me. So even foreplay can sometimes be completely a no-go.
Yeah. I read the other day that it actually takes a woman 30 to 40 minutes before she can actually be ready for penetration. Right? In order for her to have a satisfactory sexual experience.
Yes.
With no matter which partner it is. Size is not even a factor here.
No.
But how does that work when with men, they're instantly stimulated and they want to get right in there, you know?
So the thing is, it's very seldom that you can speak to anyone where a wham bam, thank you ma'am, a quickie is kind of like an enjoyable thing. Yes, like once in a blue moon, it's like everyone is lust for each other and we just like quick and over and it's 5 minutes and we're done and dusted. But if you go and look at all of the studies, women really need a lot of time to actually get stimulated enough. And I always tell the men or couples that come to me, I tell them, guys, if you just focus a little bit more on foreplay, and I hate the word foreplay because it's not tends to give people the idea of it's 4 minutes and it's done.
1 minute play.
It should actually be 20 plays. Okay? Because you need at least 20 minutes of foreplay to get a woman so close to orgasming and so less for her partner that she is going to reach orgasm. And the thing is, the longer you spend on stimulating her, the better the outcome for you as well. Because if she enjoys it, you kind of like, I did it.
And she's most likely going to do it again.
Yes, that's the thing.
And tell her friends.
Well, not necessarily tell her friends. Very seldom that women speak about sex.
Well, women will brag if they had a great sexual experience.
Do you think so?
A pattern.
I don't know about
You
well,
do.
listen.
There you go. There you go.
Sorry, babe. Yeah, but I mean, it's like a badge of honor where you're like, guys, I'm really happy with the house today. Last night was wonderful.
Yeah.
Look, I'm like 34 now, right? And I guess like my earlier stages of figuring out what, you know, sex was all about, and, you know, what's actually enjoyable and what's not. Like, I found I like to give massages. Like, really, I like to give massages. It's almost like it makes me like a little. It puts me in a situation where I feel like I'm in control of the situation. You know what I mean?
Okay.
And I realize, like, within that, I prefer a little bit more control. You know, so
we should bring in the psychologist to find out why.
Well, that's exactly
Well,
what I'm
it's
trying to
common.
find out. I'm like, oh,
It's
is it like me? Is it like an extension of my character that I want to please? Where I enjoy, it's not even like her giving me a massage, like I enjoy giving her a massage, and then I get to understand, okay, the body's speaking back, then then I, you know what I mean? Like, this is just something I recently discovered in terms of this is what I like.
So the thing is, you might just be a very giving person, and I always say that the important thing about a sexual experience is that it's not only about the one partner.
Sure.
Because we are in such a conservative country, a lot of the talk around sex was how we don't do it, okay? Before you have a ring on your finger, and it's kind of like a marital right that now you are allowed to have sex, and a lot of religions are kind of like it's for men, like sex is for men, and women just need to lie there and take it, and you give it to him when he wants it.
Mm-hmm.
But in actual fact, it's supposed to be enjoyable for both partners. And I think that's important in the sense that it's good if you are a partner that wants your partner to enjoy the moment. There's nothing wrong with that. The thing is, if it's a one-sided thing, it might be a little bit of a hazard, because obviously she's not going to please you as much.
Yeah.
But in essence, it's a give and take thing. I mean, and that's where foreplay is so important, because it's more than one sense that you use. It's touching, it's smelling, it's tasting. And the thing is, if you enjoy what your body's going to talk back to someone. I mean, there's nothing worse than having sex with someone that has their mouth closed and just lying there. I mean, I can't imagine that that's anything worse. But I mean, if you're enjoying something, you talk back, you give back. Your body sense is telling someone that you're enjoying it. But there's nothing wrong with being someone that likes giving the massages. Yes, there might be an element of you like control more and whatever. But the thing is, if it's not overtaking the whole sexual experience, and you just giving and you never want her to touch you, or you never want to receive, that might be an issue. But overall, I mean, it's a give and take situation, and that's important. Both partners should enjoy it. Tactile sensitivity, and it's very common to have tactile. There's actually an occupational therapist that did a study on that, and the influence of that on a sexual experience.
Wow.
And it's directly correlated. If they don't enjoy touching and they tactile sensitive, they don't enjoy foreplay. Because I mean, you're touching me and I'm like, ugh, please, don't go there. Yeah, so.
Like you said, the focus is normally on the female experience, and we hardly ever speak about what males actually want, because there's the myth that they just want to be in and then out of there. So I've got two questions, right? Is there anything that females can do to enhance a male's enjoyment in sexual experience? And two, where is the male G-spot?
Let me start with the G-spot, because it's this little mythical spot that everyone is supposed to find, in males and in females. I mean, it's like this little area that if you just like touch it, they are going to shoot through the roof of pleasure. Okay? It is mythical because it's mythical. Like,
Okay.
no one's G-spot is exactly in the same area. Like, I
Okay.
always say, I give premarital talks, and I always tell the guys, you're not going to be like, okay, lie down, I'm going to insert my finger, and then I'm going to be like, and then you're going to orgasm. Like, it doesn't work like that. And yes, there are areas that are more sensitive, by all means, but this G-spot, like, it's a mythical thing because it's not the same spot for everybody. Okay.
So it's not in the anus.
There is a more sensitive area in the anus, yes.
Okay.
But if you are uncomfortable with someone inserting a finger into your anus, I promise you they are not going to find the G-spot. Because the only thing that you're thinking about is, oh, this is so uncomfortable, can they just end? Like, oh, it's not nice. Do you understand? So, I mean, I want to get your G-spot, lie down. I mean, it's really like, it's going to be very uncomfortable for both partners. So that's the thing is, my advice to all couples is communication.
Yeah.
You are never going to know what the other person likes if you don't ask them.
True.
Or they don't tell you. I always use the example now, newly together couple, whether they are married, whether they are just partners, and they sit on the couch watching TV, and now the guy's like, whew, I can do with a little bit of sex right now, and he wants to like set the mood, so whoop, goes the hand on the boob, and he's like, oh, this is amazing, and she's like, feels like he's rubbing her elbow.
Yeah.
She's not going to get in
Yeah.
the mood because she's like, can you please just like get on with it, because this is irritating, this is not nice, I'm
Yeah.
not getting turned on. And he is like dripping at the seams because he's like, whoa, this is amazing. Do you understand? So that's the stuff, communicate.
Yeah.
How is your partner supposed to know that you don't like him touching your breasts
Yeah.
if Shane now you are just tolerating it because he likes it? Yes, you're not always going to enjoy everything your partner does.
Oh, Lord, she's serious. Oh.
But tell them,
Yeah.
if you are touching your partner, if a male feels like he wants a massage before sex, tell your partner. Whether it's male, 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 female, 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 tell your partner what you enjoy. Because that's the only way. The thing is, we want to share this intimate moment with each other, but we can't say penis or vagina in front of each other. We can't say, touch my breast here, rub me a little bit more there, because people feel, oh no, wait, I have to be quiet, you know, I have to just tolerate it, and it just has to go with the
It'll
flow.
go away.
Exactly. He'll find something else to rub in a few
Irritate me
seconds. Let's just wait it out. But communication is important. I always tell couples that's the first and most important way of improving your sex life is communication.
Okay, and for our transgender community, isn't that a bit more complicated for them?
Yes.
Because they well, essentially they have a new part.
Yes. So
You
the
know,
thing
so
is,
they have new ways of having to be stimulated and even discovering how that particular organ works.
makes them feel.
You know?
So the interesting thing about our trans patients is that not all of them have the surgery.
Oh,
Okay?
okay.
And it's simply from a financial perspective. So it is very expensive. Medical aids don't cover it. In government is like a 25-year waiting list. For instance, at
Wow.
in Cape Town, in the hospital.
Oh, so that's not an exaggeration.
No.
Oh wow.
No. So the thing is, the accessibility to the operations are very limited. So it's very seldom that they actually do have the organ as the gender that they identify as. So a lot of them identify, for instance, as a female, and they have a penis. Okay.
Wow.
The thing is, part of their dysphoria is the fact that they don't actually want their genitals to be touched, or they don't want an erection because she feels uncomfortable with it because she doesn't actually identify with the
With the
organ that
penis,
she
yeah.
has. So yes, it is difficult for them, But for any, whether you are cis, whether you are trans, the important thing is for you to explore your own body.
Yeah.
And yes, they do have a different relationship dynamic, because a lot of them have to tell the partner that I'm trans, but I have a penis, for instance. So it is a difficult dynamic, and it is a difficult situation to explain that to someone. It's not something that you're going to have your first date and be like, hey, like. So it is more uncomfortable. But my advice for them is always go and find out what you enjoy first. If you have to self-explore, find out what it is that you enjoy, it's easier to communicate with a partner. And it's the same. I mean, I see how many patients that have no cooking clue what it looks like down there. Take a mirror.
True.
Go and have a look. You have to know what's going on with your own body. Because if you don't know, how on earth is your partner supposed to understand completely what's happening down there? So yes, it is a difficult dynamic to kind of play.
And doctor, a lot of people during COVID have been focusing on wearing the mask and sanitizing their hands, and have forgotten all about the condoms out there in the world.
How long you knew this?
Charles, I just took it like a few minutes
Was this
ago.
from last night? That was quick.
So there's just one thing, I'm sure our audience is intelligent, so I don't want to tell them about the male condom, but the one thing that hardly anybody ever talks about is the female condom. How to put it on, what are the benefits of it. I know one of the benefits is that you can wear it all day.
Can I show you? I've got one.
Oh,
and I've got a model.
even better.
The Cupid female condom. The Cupid female condom. The Cupid female condom. Okay. I know that it is available from Discount. Okay, so you can find it there. What's nice about this one, it's got a sponge inside, so it's nice and soft to get it in. Okay. So sorry, this one is not as lubricated anymore. Okay, so that's the vagina. So if you look, this is the female anatomy. So that's the vagina. That is the bladder or pubic bone, is obviously at the top, and then that's the uterus. Okay, that's the actual size of a uterus. So a uterus is anything between 4 and 8 centimeters. Okay, it's only big if there's a baby. And then down here is the anus. Okay, or the rectum. Right, so if you insert the female condom, it's easy. You just fold it, and it's nice and lubricated, so you insert it. Okay. Right. I always say the important thing about any condom, whether it is male or female, you have to practice to use it before. Because in a moment of passion, you're going to get it completely wrong. You're going to either put it on wrong or use it wrong. Because the biggest thing about the female condom is the male penis has to go in there. And what happens a lot of times is they penetrate, and they actually don't penetrate into, but they penetrate on the side. Okay. The advantage of a female condom is it actually protects the whole vulva area. Okay. So it's actually more protective for the female than a male condom, because a male condom only protects the shaft of the penis. And I always say something like herpes, for instance. If he has a lesion on his testicles or his balls, in layman's terms, and that touches, herpes is skin to skin contact transmission. So now he touches, so the shaft of the penis is properly protected, but he penetrates, and now his balls are hanging here, and it's touching your vulva, and that's where you get the herpes. Okay, so this is actually very nice because it protects the whole vulva area. Okay, and it's nice and lubricated, so it's easy to penetrate, and then you literally just fold it and you pull it out, and everything is in there.
Okay.
So that's the female condom. I know that some discounts do have it, but the accessibility of a female condom is the biggest problem that we have, where women actually just can't find it.
Because we live in a country where sexual violence is
On a continuous rise. I think it's important for women to know that
with the female condom, they can actually protect themselves. They can wear it all day.
Yes.
So if anything happens, they're protected. Like, just to let the audience know, we arrived late. So I see on the clock that we are now passing the time that we're supposed to be here. So we're going to just ask her one last question, and that's a personal one, right? And I see that you're married with kids.
Yes.
Was your husband ever intimidated by your profession? Or was he more excited about it?
So I always say, I don't think necessarily we have the most rewarding sex life ever.
Stop! Cut!
Doctors are not good at practicing what we preach, right? So I love my husband. We have a good sex life. It's not like, but it's not something we are not outwardly like. Woo! We are like having sex 3 times a day. Like it's amazing. My husband. I always laugh because I always tell him, you still have the biggest penis, don't you? He will kill me if he listens to it. But he's not intimidated at all. I think it's not like everyone whips their pants off when they get here. There's a very misconceived idea about what we do. It's not like I bring couples and I'm like, show me your positions and I'll like give you the right position. That's not what I do. No, he's not intimidated at all. I think it's for me it's a job. For me it's not something that I now stand and I'm like looking at his penis and thinking, ooh, like, do you understand? It's just another patient. Have to sort out your problem and help you in that regard. So for me, I always tell the women are always as well as like, didn't shave, like so. Word, no, you have to do a pap smear, and I'm like, dude, if you walk out here, I cannot remember whether you were shaved, whether you were all natural, whether you had a discharge, whether you didn't have a discharge. I'm like, next. It doesn't bother me because I just don't see it that way. For me, it's just another part of you, and not necessarily something that's like off balance.
That's awesome.
Okay, so 3 things that we can basically conclude with. Right? Advice to couples, no matter what sexual orientation they are.
Okay, so couples for me would be to optimize your sex life is communication. You have to be open with your partner. You have to tell them what you enjoy. You have to tell them what puts you off. Mm-hmm. You have to work on it.
Practice
a lot of people,
makes perfect.
Exactly. A lot of people think that sex is the spontaneous thing. It's never spontaneous because someone in the relationship planned it. Okay. So always planned sex is better than no sex at all. Especially if life gets busy, it is something that you don't always think about. So rather plan it. Friday evening is our sex night. How unromantic it may sound to anyone else, at least you're having sex.
Yeah.
Okay. And number 3, do stuff together. Don't just think that sex is the only way to be intimate in a relationship. Yes, it's a very important part of it, otherwise I won't be there. But it's important to have bonding in another way other than, and everyone always thinks sex has to be penetration, but there's a lot of other stuff that you can do before then to actually enjoy each other. That's why foreplay is so important for me. If you want something nice to do for all couples, if you go on the My Sexual Health website under blogs, there's a blog about Sensate focused therapy. Okay. And I always tell everyone that comes through my doors, this is something that every couple should do. Whether you are cisgendered, transgendered, whether you're gay, lesbian, straight, doesn't matter. Okay. Every couple needs to do it because it's all about the sensual touching, sensual massaging, using your other organs and not focusing on penetration. Because we sometimes lose the intimacy part of it just focusing on penetration.
True.
So that would be my golden cents worth.
Sure. Got a lot to do, guys.
Yes.
Don't forget to be safe. And thank you so much, Dr. Badenhorst, for coming through. You don't mind if we put your email on? Okay, we'll put an email on the screen so you are able to contact her if you need to give her a shout. And the website is over here. It's
Yes,
mysexualhealth.co.za.
Yeah.
And thanks again. You know, we hope you gained something from this chat. I certainly did.
Woman, if you're in pain, listen. Consult.
It's not your fault.
Consult. Yes.
Yes, it's not your fault. And men out there, just be a little more patient. You know, treat us with a little more kindness and we'll do the same. 20 minutes. 20 minutes. And we'll all come together. Ciao. We'll see you guys on our next episode. Bye.